Have you ever felt itching, redness, or a strange discomfort in your skin or private areas, but you weren't sure what it meant? It's something many people experience but are too shy to talk about.
Most of the time, people think these small symptoms will just disappear. But sometimes, these are signs that a natural fungus in our body called Candida is starting to grow too much.
When that happens, a simple irritation can turn into real infection. This very common condition is called candidiasis. So, let's understand what candidiasis really is. Candidiasis is an infection caused by a fungus called Candida, most commonly Candida albicans. Candida naturally lives in our mouth, on our skin, in our intestine, and the genital area. Normally, our immune system and good bacteria keep it under control. But when the balance is disturbed, Candida grow too much and cause infections.
The main causative agent is Candida albicans, although other species like Candida glabrata can also cause infection. Several factors can increase the risk. Taking too many antibiotics removes the good bacteria that control Candida. People with weak immune systems, such as those with HIV or undergoing chemotherapy, are more at risk. Diabetes, especially when blood sugar is not controlled, makes it easier for Candida to grow. Hormonal changes during pregnancy or when using birth control pills can disrupt the balance. Wearing tight or non-breathable clothing drops moisture. Moist skin folds, sweating, and poor hygiene also increase the chance of infection. Steroid use, including inhalers, can further weaken the body's natural defense. All of these conditions can allow Candida to grow faster than normal.
The symptoms depend on where the infection appears. When Candida affects the mouth, white creamy patches appear, along with soreness and difficulty swallowing. When it affects the vaginal area, there is strong itching, redness, burning, and a thick white discharge that looks like cottage cheese. On the skin, candidiasis forms red, itchy rashes in moist areas like the armpits, groin, under the breast, neck, or diaper areas. In more serious cases, when Candida reaches the bloodstream, patients may experience fever, chills, or organ infection. This is a medical emergency. Even though some symptoms might seem small, they can cause major discomfort.
To diagnose candidiasis, healthcare providers use different tests. First, the KOH test is done by taking a sample from the affected area and mixing it with a potassium hydroxide, which helps make candida visible under the microscope. Second, a culture test helps identify the specific candida specimen, and for more serious infection, a blood culture is done to check if candida has entered the bloodstream. Third, for vaginal yeast infection, the vaginal pH is tested. In candidiasis, the pH usually stays normal, which helps differentiate it from bacteria infection.
Nursing care aims to relieve symptoms, stop the fungal growth, and prevent recurrence. Antifungal medications such as fluconazole, nystatin, or clotrimazole are given as prescribed. The nurse teaches the patient to keep affected areas clean and dry and to avoid tight clothing that traps moisture. Patients are reminded to complete the full medication course to prevent relapse. Education is important, especially on avoiding unnecessary antibiotic use. For diabetic patients, monitoring and controlling blood sugar levels help prevent recurrence. Comfort measures such as sitz bath for vaginal infections or cool compresses for itchy skin help reduce discomfort. The nurse also teaches the patient to avoid scented soaps, harsh detergents, or feminine wash products that may irritate the area.
Candidiasis can be prevented by following simple daily habits. Practicing good hygiene and keeping skin folds dry is essential. Wearing cotton underwear and loose clothing allows the skin to breathe. Avoiding unnecessary antibiotics helps maintain the balance of good bacteria. For people with diabetes, controlling blood sugar reduces the risk of infection. Avoiding scented feminine products and harsh soaps helps prevent irritation. Changing out of wet or sweaty clothes also helps stop candida from growing. Small habits make a big difference in preventing infection.